Dr. Kate Tulenko. She's the CEO of Corvus Health. That's a global health firm. Kate, thanks so much for joining us. Things in India are getting worse. Any sense in your observation of when they might get better, when there might be a light at the end of the tunnel for Indians?
They still might be in for another couple of months of surges. In fact, the chief scientist in India is predicting a third surge, and this is for a number of different reasons. One is that the levels of circulating virus are just so high that inevitably other people are going to get the virus. Also, India has some of these variants that are more infectious, and in addition, people, of course, are taking care of their family members since there's not room in hospitals, and so these caretakers are going to get COVID as well.
And we've heard about things like double variants as well. What have been some of the biggest challenges for India in this latest surge?
Really, the biggest thing has been medical oxygen, and it's been extremely controversial, and I think that's for three reasons. One is that there haven't been any guidelines on how they should ration the oxygen. To give you an example, the usual medical use of oxygen, you need to keep someone's oxygen level in their blood above 93%. But perhaps in a crisis, that level should be changed to 83% or a lower number in order to ration it, but that hasn't been done. And actually, a colleague of mine whose mother was hospitalized in an emergency COVID hospital in Mumbai, she had an oxygen requirement, but she was only given oxygen a couple of hours a day, which certainly is not standard of care. Another issue is that it's unclear in Mumbai or Delhi how many people truly need oxygen. Some of these estimates are based on just the caseloads, the number of people diagnosed a day, and that can be very different from the number of people who require oxygen. And then the third challenge is this issue has become highly politicized, with the Congress party blaming the BJP, and the Indian Supreme Court has now stepped in and set up a task force to look at how to better ration the oxygen.
Tamil Nadu became the latest state to announce a complete lockdown. Is this the best strategy? Prime Minister Narendra Modi in late April pleaded with states to use it as a last resort. We saw the first lockdown in India after some 500 cases, largely criticized for causing a migration crisis.
Well, in an emergency like what is going on now, I think it is the right choice. And I think, a year in, people know better how to handle these lockdowns. And Tamil Nadu is a very business-minded government. And so the fact that they're locking down really speaks to how bad the conditions on the ground are. But I think it is the right move at the time.
Some parts of India are faring better than others. Uttar Pradesh has a population that's greater than Germany, France, and Spain combined, and it's done and is doing better than most of Western Europe has. One obvious contrast is what's happening now in Delhi versus Mumbai. What does that show us in terms of organization, leadership, response, proactiveness when you compare these two?
It's difficult to say because part of it might be that they're using different oxygen requirements. As I mentioned, my friend's mother was not receiving the oxygen that she needed in Mumbai, in Uttar Pradesh. And part of it might be, better organization. Mumbai is known as the business center of India, whereas Delhi is the political center. And so that private sector reliance, may have made them better prepared. But it really is difficult to say at this time.
And what has been the impact on rural areas from what we've seen?
It's hard to say because there's a lot less testing in the rural areas, and often when people pass away, sickness is just put on their death certificate, so we don't know really what they're dying of. I mean, we do see some people moving from the urban areas to rural areas to try to escape the high rates of COVID, but we also see some people, when they get sick, moving from the rural areas to the urban areas in order to seek medical care.